Hi, Janice B, Quit Coach here. Today I wanted to just quickly talk to you about the drug therapies available to help people quit smoking. There's been over 1,000 clinical trials conducted on these very effective therapies. And so you can rest assured that they're very safe for you, especially when used in the right doses, in the right situations, and especially when added to support. So working with a healthcare professional or a quit smoking coach in the same way that I work with people. So if you need to smoke within 30 minutes of waking up, you likely would benefit from drug therapy. You're probably quite addicted, quite dependent, and so you should seriously consider adding drug therapy to your quit plan strategies. Drug therapy does not make you want to quit. However, it does control the withdrawal and cravings, and those are the two biggest reasons people relapse to smoking. Nicotine replacement therapy, it contains nicotine, but not all the other harmful chemicals that can be found in a cigarette. And eventually in time, you reduce the dose of the nicotine replacement therapy as well. The biggest reason people fail when using NRTs is that they may not be using the right product or the right dose. Just as a point of reference, there's about 1 to 2 milligrams of nicotine in every cigarette. And so your startup dose of nicotine replacement therapy should closely match the amount that you were getting from your smoking. Ask your local pharmacist to help you pick the right product and the right dose. The next item I wanted to mention was Champix. So it does not contain nicotine, but it binds to the nicotine receptors in the brain. And it releases not the same amount, but some of the dopamine that a cigarette normally would. And it binds to those receptors so strongly that when you do smoke, you don't get the same smoking satisfaction you normally would from smoking. The Zyban is actually an antidepressant that affects certain chemicals in the brain to help reduce symptoms of nicotine withdrawal, things like irritability and anxiety. Both Champix and Zyban require a prescription from your physician or nurse practitioner and should be started approximately 8 to 14 days before your quit date. That's so they have a really good chance of starting to work before your quit date approaches. Nicotine replacement therapy can be purchased just at your local pharmacy without a prescription, and it can be started at any time. If you have any more detailed questions or concerns about the drug therapies to help people quit smoking, feel free to just shoot me an email at jbquitcoach@gmail.com. I'd be happy to answer any of your questions. And we'll spend some more time diving deeper into each drug therapy in more detail in separate videos in the future. Stay tuned. Bye-bye.